Brushing your teeth might seem like the most ordinary hygiene habit in the world. But what if I told you it has a direct impact on your blood vessels, including the blood vessels responsible for erections? Sounds exaggerated? Science says otherwise. The elegant part is that the explanation is simple. The surprising part is that it's absolutely true. Today, we're stepping into periodontology because what happens in your mouth does not stay in your mouth. Welcome to the oral cavity. Your mouth is one of the most crowded biological environments in the human body, a bustling marketplace of bacteria, viruses, and fungi. Think of it like a Star Wars cantina, crowded, noisy, unpredictable, and not everyone is friendly. Here's a fun question. What's more dangerous, a dog bite or a human bite? Most people know the answer even before I say it. Human bites are far more severe because the bacteria in our mouths can be aggressive and destructive once they invade deeper tissues. Normally, your immune system keeps all these microbes under control. But every now and then, some of them sneak past the defenses and enter your bloodstream. Your immune system fights back. But just like in Star Wars, the dark side always seems to have more TIE fighters coming. Some of these bacteria release toxins that quietly disturb your internal balance. Over time, this results in inflammation. And chronic inflammation is where the real trouble begins. Inflammation isn't always bad. It's a normal response meant to protect the body and repair tissue. But when inflammation becomes chronic, things start breaking down. A chronically inflamed body struggles to produce nitric oxide, the gas your blood vessels and nerves release to create an erection. No nitric oxide equals no meaningful blood flow equals no erection. This is why men often ask me whether supplements like citrulline, pycnogenol, or others can fix the issue. I'll get to that shortly. But none of those supplements matter if your nitric oxide producing system is constantly clogged by inflammation. And one of the most overlooked sources of chronic inflammation? Your mouth. If you're finding this video helpful, show some support. Hit the like button, subscribe, and share it with someone who needs it. Your gums are the front line. Brushing twice a day isn't only for fresh breath. It keeps your gums strong and prevents bacteria from getting access to your bloodstream. Flossing, or using interdental brushes, especially before bed, is even more powerful. Because there is one oral disease that truly changes the game: periodontitis. Periodontitis isn't just gum irritation. It's a destructive process where bacteria, inflammation, and tartar weaken the structures that support your teeth. The gums become a leaky barrier. Bacteria and their toxins gain easy access to your bloodstream. The statistics are alarming. After age 35, 1 out of every 2 adults has periodontitis. After 65, the number climbs above 90%. And yes, people begin losing teeth because of it. Now here's the connection that should make every man pay attention. Severe periodontitis closely correlates with erectile dysfunction. Correlation does not automatically mean causation, but in this case, the biological explanation is clear. Periodontitis causes chronic inflammation. Inflammation blocks nitric oxide. Nitric oxide controls erections. And periodontitis isn't alone. Many conditions that generate inflammation also damage erections. Excess abdominal fat, high blood pressure, diabetes, sleep apnea, and more. But the oral cavity might be the most underrated and ignored factor, simply because medical doctors aren't dentists, and these two worlds don't talk enough. One of my favorite questions whenever something in a patient's health doesn't make sense is, could it be the teeth? You'd be surprised how often the answer is yes. Now, about supplements. If you've watched my video on supplements for erectile health, you know most of them work by boosting nitric oxide. They provide the raw material. But if your body is chronically inflamed, the nitric oxide factory is essentially shut down. No production, no effect. So supplements can help, but only if inflammation is already low. That means the foundation comes first. Brush twice daily. Floss or use interdental brushes. Get professional cleaning once or twice a year. Reduce inflammation at the source. Then, and only then, can supplements actually work.